video. Today I'm so excited, I'm so happy to welcome you guys, and we are continuing to learn. Each and every day is a learning day, new stuff, new things. I'll be so excited to get questions from my viewers. I'll be also humbled. I'll be answering questions as they come. And being the first videos I'm doing live, I publicly welcome everyone who's joining me. And this is to let the public know that my main reason why I'm doing these videos is to educate guys, the public, families, people of all races, of all from all the different types of the world, on things that they can do at home while they wait for to get medical attention at their nearest hospitals and health centers or even clinics. Yes, welcome. I can see one of you guys joining me, and I'm so excited for real. Wave, leave a message, leave a comment. We'll be learning, and your questions will motivate me each and every day, and your comments as they come. Yes, I can see people joining. So the main purpose of this video or my YouTube channel is to be educating the public about the common conditions that they face each and every day and how they manage them as at their homes before they can be able to seek medical attention at the nearest facilities that where they live or where they usually get medication or attention from. So my major we have measured on in our previous videos that I've been able to upload. I've done a few conditions, one of them being a fever in children under 5, what you are supposed to do, and I'm going to do a little bit of recap, so that you guys who are joining me can be able to. Thanks for the like, I'm so humbled, thank you so much. So the recap of today, we are going to talk about fever in children because I'm now live. If you get your baby who is below 5 years running fevers, what you're supposed to do at home before you are able to take them to the hospital. That is one of the things I'm going to recap on from the previous uploaded videos that I've done, because this one I'm live. So fever is one of the things that really affect babies each and every. It's the commonest condition that we get in children, whether they are sick or they are not sick. They are prone to fever on and off. So what are you supposed to do as a parent or a caregiver when you have a baby with fever at home? Because one, fever can expose the baby to having other problems, e.g. convulsions, which are very dangerous to the baby's brain. That's why we say you have to take care of the fever before you can be able to take the baby to the hospital. And another thing I've warned people about is taking the baby, instead of going to the hospital, they are heading to the chemist or to the pharmacy to buy drugs. If your baby is unwell, even if they are coughing, they have fever, or another thing that you feel your baby is not well, kindly take your baby to the hospital. Stop buying drugs from the chemist. That is one of the things that I want to stress on. So, what are you supposed to do if your baby had a fever? First of all, stay calm. Don't be anxious, because these are the things that you start panicking. You will hear some mothers screaming because the baby is convulsing as well. Kindly stay calm when the baby is having fevers. Then put your baby on a comfortable flat surface, either on a sofa or on the bed, somewhere comfortable. Remove all the clothes that the baby has, especially the heavy ones, so that, because they add more fever to the baby. So the baby will be running high temperatures because of those fevers. So of the heavy clothes that they're on. Remove them all. After that, thank you, girl. I'm so humbled. Thanks for joining. So after putting the baby on a flat surface, remove all the clothes. Leave the baby with just like something light like vests or pampers. Then look for warm water. Boil water to warm, lukewarm. Then sponge your baby. Take a face towel, put water in the patient, then sponge the baby. The other one is, after you have done that, if you have any other antibiotic drugs like paracetamol or Brufen, give as per the doctor's prescription, because children are given medication as per their age and their weight. So if the bottle is written 5 mils, make sure on your medication that you have, maybe that paracetamol or Panadol or Brufen, take a teaspoon. If it's written 5 mils, give the baby. Then after everything is done, the baby's calm now, you too, you are calm, you can prepare yourself and take your baby to the hospital for treatment and for examination, investigations, and the right treatment. Kindly don't take your baby to the chemist, or let not your girl, house girl, or any other person that you left the baby with call you while you are at work, telling you that your baby is unwell. Then before you even go home and see the baby, you decide to pass by the chemist. Don't do that. Just go home, see the baby. After you have seen the baby, take the baby to the hospital for examination, investigations, and then lastly, for the right treatment from the doctor or your clinician. Another recap we are doing today is about the acid production, high production of acidity in patients. There's different categories of patients that we are going to talk in our next videos. And this particular category is hyperacidity in patients, adults or children, because people tend to assume that children don't suffer from acidity. They do, of course, by the way. So how do you manage acidity at home? Some of you guys know how to do it because it's something that you have been with for a while. So your doctor has already told you this is what you do, ABCD. Some of you will benefit from a recap because it is a reminder that maybe you have forgotten what did my doctor say, and what am I supposed to do and what am I not supposed to do. One of them, if you are someone who suffers from a lot of acidity and you are smoking or you are taking alcohol, kindly stop. Those lifestyle things that we do that cause us problems, you are supposed to take them. You are supposed to stop. Number 2, there are some meals or some fruits that you can take and they will worsen your condition. Which one of them are these ones? One, fruits like mangoes, pineapples, oranges, passion are citric, acidic fruits in nature. They have that sour or bitter taste in them. So in acidic patients, we tell them to avoid these fruits as much as they can because they aggravate or they worsen the condition of the patient or that person that is suffering, either baby or an adult. Number 2, you are not supposed to stay for long without feeding. Like you take your breakfast in the morning and then until evening is when you are going to take a second meal. So have your meals frequently. We say you take small portions of meals frequently throughout the day. Like you can take 3 main courses, breakfast, lunch, and supper, and then in between those main courses, you can be able to snack. And whenever we say snacking, We mean you can take something small like a watermelon, a piece of watermelon, a piece of apple, a paipai, and or another thing that you have, you can take that is you can tolerate, that does not make you have experience heartburn or experience um, that burning sensation in the stomach all along the esophagus, the middle chest, this part of the chest. That's where most people will complain about. Now, other thing that you have supposed to do to avoid are meals that can aggravate your condition, like beans. That is includes githeri, that is cooked with beans. Spicy food like pilau. Pilau is the most spiced meal that we know here. So because the spices can aggravate the condition that you have, so you need to stop. Royco is another thing. This is a major ingredient in most Kenyan kitchen or the world all over. So Royco is classified as a spice, so you should stop taking Royco wherever you are cooking or putting Royco in your meals because it's a spice. So on those more frequent meals that you are doing, I have 3 principles of how you manage hyperacidity. Number 1, what do you eat? When do you eat that? And how do you eat it? Because how means you are not supposed to eat a whole mountain of meal wherever you are doing. Let's say maybe it's lunch, and since I said you are supposed to eat small frequent meals, you don't have to eat a whole plate, full plate of ugali or with samaki, because I just say it's the right food. You have to eat 3/4 of the meal that you are taking. Then, so that a quarter is the remaining space for the next snack that you are going to take, because your stomach needs to be at all times as something for the digestive juices to work on. Because if you leave your stomach empty for a long time, wherever you start producing the acids, they are going to irritate gastric lining, they are going to irritate your esophagus lining, they are going to irritate your throat lining. Then you will be experiencing pain on swallowing, and you'll be assuming it's tonsillitis or a sore throat. And at some point, you might have other complications of hyperacidity because of that continuous burning of the gastrointestinal mucosa. So other complications are long term, like bleeding, perforation. You see you have ruptured blood vessels. You are vomiting blood so seriously. People have ended up being transfused blood or being done emergency surgery because of the rupture of those blood vessels along the GI. Other things that you can have later on is cancer of the esophagus, cancer of the throat, cancer of the stomach, or the duodenum, because of that persistent production of high acids that causes a lot of havoc on your GI system. Then you end up having those complications in life that you are told you have cancer of the stomach, and you are wondering, where did I get cancer from? Because in my family we don't have that. Sometimes we associate some things, family history. If someone in your family or someone close to you, you know, had cancer, then one day you are told you have cancer of such and such an organ, you are like, okay, I had one of my relatives had that. So sometimes it's not entirely on genetics. Sometimes it's on what happens to us each and every day. So that is all about the another thing that causes hyperacidity that we really know is a bacteria called H. pylori. This one you need to go to the hospital for a checkup. As per the explanation or as per the complaints that you tell your doctor or your clinician, they can be able to tell you, do a lab test for us. You will give us two. we do a lab test called H. pylori bacteria, which if it turns positive, it's one of the predisposing factors of hyperacidity as well. So this one has to be treated because it has its own medication. You take it for a duration of time. After that, it's rechecked again, but the management is the same. After you are done with the medication, you have to continue with the diet as advised and lifestyle modification. By if you are drinking, you stop. If you are smoking, you stop as well. Other things that you are supposed to know is we have had people who come with a chronic persistent cough, that throat pain, voice changes, hoarseness of voice, throat pain or irritation or dryness, without knowing that it's because of the hyperacidity they are suffering from. That's why they have that. Someone wakes up in the morning and on talking, their voice is not the same like when they slept yesterday. So hyperacidity can cause that. Hyperacidity can cause you a chest pain, and you might think that the feeling is almost like you are getting a heart attack. And there's that pain you get that is initially from this part up to your esophagus. This is the esophagus that is here. Then backward to this place here. So you feel pain from anterior, just here in front, to the posterior, backward. That is a sign of, one of the signs of someone suffering from hyperacidity. And a complication is setting up called GERD because of recurrent regurgitation or reflux of acids to your chest. So take care of your diet, take care of your lifestyle, know what you are eating, when and how, so that you can be able to control your acid production before you can be able to go see a clinician or a doctor. But one of the things that I'm going to say, kindly, wherever you have a problem, go to the hospital, a healthy center near you, a private hospital where you are, if you can afford one, or see your doctor that you usually see wherever you have a problem. Some patients know what they use whenever they have a problem like that type of acidity. Some of them are being seen somewhere, so they know the medication they are using. Don't abuse drugs. Just take that to relieve your symptoms, and if the symptoms are worse, see your doctor for further investigations, because you might be having a different problem and you are thinking it's the acid that you're having that's making you feel the way you are feeling. So, that said and done, we want to wish you guys well, that wherever we have a problem, our major stressing, we want to stress that stop doing medication over the counter as well. Those medications that you do over the counter might be a reason why you're having more problems and more problems, because you are doing drugs that you don't really know if they are treating what you are suffering from. The advantage of going to a hospital or a clinic is that you are able to explain yourself. The doctor can use the parameters of seeing a patient to examine you, inspect, investigate, and if possible, send you for radiological investigations like an X-ray, an ultrasound, before they can be able to give the drugs. And they give drugs as per the severity of a condition. Our third recap from the previous video is about antibiotics use and the abuse that you guys have done, because most people have really abused drugs. You just have a flu, you end up in a chemist to buy drugs for flu. As you explained, you are given an antibiotic. This one, amoxicillin, this one, azithromycin, that one, without knowing that it's not every condition that you're having that is supposed to be given an antibiotic. For example, flu is a virus disease. There is no room for antibiotic use when you are suffering from flu symptoms. But because you took yourself to the chemist to buy medication or do self-medicate, you end up getting the wrong drugs for your condition. In fact, drugs are not supposed to be sold over the counter without a prescription. E.g. antibiotics. Antibiotics needs to have something documented, a prescription written from the doctor with your name, age, gender, date of the prescription, and then lastly, the prescription itself, including the dosage and the days you're going to use the drug. So stop buying antibiotics from the chemists, because we are developing drug complications due to inappropriate use. For example, people have developed drug resistance because of using antibiotics wrongly for wrong reasons. Number two, there's something called drug dependency. So once you go to the chemist, you'll be buying the same medication over and over again because you think it's the one that works for you. So you develop drug dependency and a habit. There's that habit that you want to, it is going to be something in you. Another thing that makes me say stop buying drugs from the chemist is people have developed drug allergies without knowing that the drug they were taking from the chemist without a prescription is the same one that is affecting them. In the hospital, once you are given a drug, you have the assurance that once you take the drug, in case you have any other thing that you feel abnormal before that you start feeling after you take the drug, which you were not feeling earlier, you can be able to go back to the hospital and explain yourself and tell the doctor or the clinician or the personnel there that doctor, after I started taking this medication, I've started experiencing APCD, and they can be able to pinpoint which specific medication you are on and which one do they think you are reacting to, and they can take action. By the way, drug allergies are very serious. They can kill. So please, for the sake of your good health, for the sake of your children, for the sake of the people you love most, you can take a drug and die without knowing because you just went and bought them. Maybe you had another underlying condition and that drug you have taken is contraindicated. It's not supposed to be given in such a condition that you're having. Yes, you might be treating this one, but and behind the scenes, you still have another problem that needs to be sorted, and then maybe the drugs you have been given change to a different one to accommodate the other condition that you're having. So stop taking medication without a prescription from the doctor or the clinician. Guys, as as I'm almost finishing my video today, like I said earlier, this being my first live video, I welcome you guys, and we will be doing more and more of these videos tomorrow, the day after, in future. I would love you guys to leave me a comment so that we can be able to get through you, answer them. If it's a clarification, we'll clarify whatever you are asking us. If it's an input, kindly do so. I appreciate, because I have my colleagues online. So if you see this video, my colleague, and you feel you can do an input, I'll appreciate as well. If you have any other questions that you want me to talk about in the next video, I'll be much humbled to do that. And please, as you watch them, don't forget to subscribe, like, and share. by doing so, we will make more people learn and we'll be on this journey together. Thank you so much and may God bless you. Thank you.